Welcome to Focus Today. I'm your host, Perry Atkinson, and always a delight to have in the studio with us Dr. Joel Klein. He's with Ventana Wellness, and he's kind of like the Shell answer man in medicine.
I don't know about that.
Well, you know, gas and pills kind of go together. Anyway, taking on an incredible topic today, inflammatory and autoimmune disease treatments. Wow. And I made the statement on the air earlier, so correct me if I'm wrong, that one of the major contributors to having problems with sore joints is sugar.
Well, that's, you know, it's what the sugar does.
Okay.
And that's one part of the problem. I mean, the main thing here, we're talking about not, you know, all the different causes of arthritis. And, you know, and as we've talked about over and over how aging is accelerated by inflammation. So all of these chronic conditions of aging are worsened by inflammation, and then we're getting even deeper into regular arthritis, and then the autoimmune diseases are these things like most people will know of rheumatoid arthritis. And then you get into things like lupus or the inflammatory bowel diseases like Crohn's disease and ulcerative colitis. There's, you know, more and more evidence they all have a common root, and they're just affecting different systems. And there are a number of different factors that are going into this, but a huge one does have to do with the changes in our gut that sugar will produce, and also in the environment of our body that promotes inflammation. So that's one part of it. But really, there are all bunch of things that have happened technologically over the past 100 years that seem to be all ganging up in the same way in terms of promoting these inflammatory conditions.
Ah, boy, this is loaded. So is autoimmune diseases primarily a result of diet?
That's a good question. Actually, you know, diet clearly plays a part of it. I think diet may be the end point for many, many, many people. The autoimmune diseases have a significant component of these inflammatory type of allergy to food. But where does that inflammatory allergy come from? Well, from the changes in our gut, from our technological diet, from drugs like antibiotics in particular, changes that have happened to the GI tract that then cause problems, and we start reacting to foods that we didn't react before, with gluten being number one on the list for many people. Dairy, corn, and soy also high on the list. It turns out the foods that we're eating most of the time may actually be the culprits, and it's certainly the ones that our government subsidizes, so they're cheap and convenient to be in our food that people are eating all the time, are a lot of times the worst culprits.
Wow. All right, so let me jump ahead and we'll come back.
Right.
We're hearing people say, well, you get lupus, you get some of these other inflammatory diseases. Trying to think of the one where you ache all over.
Well, rheumatoid arthritis.
Yeah, that.
Well, fibromyalgia, that's a little different.
Okay.
A lot of fibromyalgia is actually hormonal. It's not an inflammatory disease because when you biopsy the muscles, there's no inflammation there. Inflammation will produce increased numbers of white blood cells in the area. There are tissue changes that happen with true inflammation that you don't see with fibromyalgia. So fibromyalgia is more often a pain condition, but not necessarily an inflammatory condition.
Okay, so
that's a whole nother topic.
All right, we'll take.
I can do a whole
we should
show
do a
on
show
that.
on fibromyalgia.
Oh, absolutely.
Well, let me ask you this, since we're on it, just quickly: can you get cured of it? Because
a lot of the times, yes. It turns out, again, just like many medical diagnoses, fibromyalgia is a descriptive term. It's not a real thing that exists in nature. It is something we've given a label to for a pattern. In many people, that pattern can be cured because it turns out there's a hormonal, particularly thyroid and some other things that are causing it. In other people, there are changes in the way the brain conducts pain that have to do. Many people can be better if not cured.
Wow. All right, so back to the autoimmune diseases. Can they be reversed?
In my experience, yes, but it's not easy.
Okay.
I have two main weapons with those. The one is the restrictive diet. Now, the problem is, well, how do I know? The regular kind of food allergy testing will not detect these inflammation type of allergies, and there are a couple of specialized labs in the country that do this. It's very expensive. It can cost $400 to $600 to get those kind of tests. So what we usually do, what I like to call, and many of the viewers will know, what I call the Casablanca approach, from the scene in Casablanca when Louis the police chief says, round up the usual suspects. So we round up the usual suspects of gluten, dairy, corn, and soy. I will put people on a very restrictive diet of like no grains and no dairy in the beginning, and just certain foods that are much less allergenic. That is number one. And then there's this avant-garde treatment that is very effective for a lot of people with autoimmune disease called low-dose naltrexone therapy. Whoa. Naltrexone is a drug that was developed to treat narcotic overdoses. But it turns out that very low doses that a compounding pharmacy makes up, 1/10 of the regular pill dose, but taken once a day at bedtime, has these dramatic effects. It works through endorphins and complex cellular biology, but can have a dramatic effect on people with reversing this autoimmune response. The only side effect can be sleep disturbance. People are taking it at night. Most people will describe very vivid dreams, but they're not disturbing. Some people, it's disturbing enough we have to maybe lower the dose, maybe give it a different time of day, although most of the research done found that it's the nighttime dose, but we can work with that. But I've had some incredible successes. Lady with 20-year history of rheumatoid arthritis who was deformed in the hands, who after putting her on the full dose, low dose naltrexone, this was in Colorado, and then I had to move here, she sent me a card, says I haven't had to take a Tylenol since starting the naltrexone.
Wow.
So not a panacea for everybody, but between the diet and the naltrexone, I can get a lot of people can get significant relief and even come off their some of, if not all of their drugs, but at least some of their drugs.
What are the signs of a, say, an autoimmune disease? I mean, we may feel some aches and pains and we say, oh, just a normal day. But
those are the more typical ones. Okay. So the ones that cause arthritis we know about that are more lupus, but lupus also causes rashes. But lupus and rheumatoid arthritis, joint pains are going to be the common one. There are other autoimmune conditions. One of the most common definable cause of low thyroid is an autoimmune thyroid inflammation called Hashimoto's thyroiditis, named after the Japanese doctor that described it. Now, what we find when we treat people is a number of those patients, if they don't do anything, the thyroid a lot of times is the first thing that shows up, they will go on in 10, 15, 20 years to develop rheumatoid arthritis. Whoa. Or lupus or those kind of things. Then there are also the inflammatory bowel diseases, which are also autoimmune. And those, again, Crohn's disease, ulcerative colitis. But most of the time we're dealing with inflammatory causes of arthritis. Now, the arthritis most people get is osteoarthritis. That's not necessarily an autoimmune problem because we can't find, autoimmune means we can find antibodies in the blood that the body is producing against its own tissue. You can't find that with osteoarthritis, but it still has an inflammatory component. That's the most common cause, is the osteo. So that's why, but that also can respond to dietary changes.
So where does the testing start, Dr. Klein? You start with blood, or do you do thyroid, combination of things?
Well, it depends what somebody's coming in with, obviously. So most of the time, what we're doing, they're coming in with a pain problem. So we're going to do a standard rheumatologic blood work where we, of course, do a blood count. We do inflammation markers called CRP and sedimentation rate, and then look for the more common causes. So there's a rheumatoid factor, which is negative, and now there's a more sophisticated text that has a long name of cyclic citrullonated peptide for rheumatoid. And the ANA test, which looks for antibodies against DNA, that a lot of these rheumatologic conditions have in common in different ways, is that we're actually making antibodies against our own genetic material. Now, some people hypothesize it's not, the body's not doing something wrong. The genetic material has been damaged by our diets and toxins and things, so the body's reacting against this damaged genetic material.
Wow. All right, the big question before we take a break, where was this stuff 50 years ago? Is this a result of our lifestyle, our environment?
It was there. We're seeing more of it. And again, how much of all the technological issues of why we see more of these diseases. Some people just say, well, we're living longer. Well, maybe. Part of the issue may be both diet, environmental toxins. There's a hygiene hypothesis. We talked about a lot of these issues with our dysfunction of immune system start with the disturbance in our gut, of our relationship with bacteria. And we become, since the 50s, so scared of bugs and germs, that we've over-hygienized things. That's why kids love to play in dirt. There seems to be an adaptive response to our relationship with normal bacteria. And when we lose that, our immune system doesn't function properly.
All right, we'll take a break when we come back. I mean, there's so many other areas in this whole discussion, but some people will get diagnosed, say, with lupus or Crohn's disease.
Right.
They own it.
Oh, yeah.
And that's it. I mean, wait a minute. Time out here. Can we get you through this?
It's like many diseases. It's now mine.
Yeah.
Yeah, and yeah.
Okay. We'll
Common
talk.
in medicine.
All right. All right. Dr. Joel Klein with Ventana Wellness. By the way, ventanawellness.com is the website. Great resource. We'll take a quick break. We'll be right back.
Hi, I'm Paulina, and I work at theDove TV. Did you know that when you support theDove TV, you have a profound impact, not only in our community, but around the world? It's your continued support that takes the inspiration and hope in the programs we produce and makes them available to the thousands of people who are watching these videos online every week. Help bring encouragement and hope to our valley and beyond by making a secure online donation today at our website, thedove.us.
All right, we're back with Dr. Joel Klein from Ventana Wellness. And by the way, ventanawellness.com is the website. It's a great resource, and the clinic is all-encumbering. I mean, you guys provide, I don't know how much you're doing over there now. We're just talking between the breaks here. You're expanding.
Yep. Well, we need more room, so we're moving administration and the dermatology folks over into the Rasa Yoga building next door, so we have more room for more practitioners that we are going to be bringing in.
Well, that's great. We're talking about inflammatory and autoimmune disease treatments, which is a huge topic. And as I said going into the break, Dr. Klein, so often people are diagnosed with, say, Crohn's disease or lupus or something like that, one of those diseases. And it's kind of like, all right, now I got an identity, what I have, and I'm going to change my lifestyle to live with it. Wait a minute, time out.
Well,
Yeah,
see, the thing is, what people, again, the medical diagnostic system is 200 years old. And the diagnoses, we all of a sudden we take this label and turn it as if it's a real thing. Yeah. It's like some people describe it as eating the menu rather than the meal. So the label is a descriptive term for a particular constellation of symptoms that commonly occur together. Right. That's actually what the word syndrome means. Syndrome is just Greek for occurring together. Okay. So we take these things that commonly occur together and we assume, that's a real thing. Mm-hmm. It's a pattern. And my experience is the pattern has to do with the interaction of that person's genetics with their environment. So you can have different patterns show up with the same underlying cause, whether it's the food issues, the gut, and these kind of things, because I'll deal with all of them basically the same with what I do. Now, medical research is geared towards, well, first you have to have the label, and then we're going to study that label. So you're going to have disease-specific treatments because that is how medical research is oriented. But when we deal with things from a functional standpoint, two people with completely different diagnoses may have the same root cause.
All right. So, the other point I want to make here, all these diseases, when you begin to treat them, there's no cure-all. There's no one pill that takes care of it. You're on a lifestyle change here for the most part. Yeah,
well, like say, if there's one pill, but it's not always a miracle. It's the naltrexone can make a difference. But but my experience is it takes all of these different things because your body is obviously severely reacting to something. Now, can we extinguish that over time? We don't know. We certainly can make it a whole lot better. There are people who have been cured. More often, we get people less dependent on their medications or doing a whole lot better. But I had one lady with ulcerative colitis where 95% of her entire colon was inflamed. And 3 years of doing the diet and the naltrexone, and she's actually out of state. I treated her because her sister was a patient of mine. And she sees a professor of gastroenterology at Northwestern. She's in Chicago. She had her follow-up colonoscopy 3 years later was 100% clean. Wow. No inflammation at all. And even this gastroenterologist was a bit surprised at that because you usually don't see that in people with 95% of their colon inflamed. So it happens. More often, we can help people feel better, be on less medication, certainly functioning better. And a lot of these stronger medicines now have risk of cancer. and other things with them. These immune modulating, these disease modulating drugs have a small risk of like lymphoma and cancer. And if we can get people off of those, then I feel we've done them a world of good.
All right, so the alternative therapy that you're talking about comes as a result of an exhausted examination, obviously, from blood to thyroid and all of those things.
Yeah, we're looking at all the different issues. Hormonal factors will play a role in increased tendency towards inflammation. So I'm really doing a whole look at the person and, quite frankly, the trajectory of their entire life's history. Very commonly, I will find severe trauma, emotional trauma or physical trauma. We'll find frequent infections in childhood that were given lots of antibiotics that messed up the gut. So this has really been a decades-long progression of the person's life that will give me the clues, we need to focus on that, we need to focus on that, we need to focus on that, because the diagnostic testing is not 100%. They even taught me in medical school, God hopes they're still teaching this, that the history is 90% of the diagnosis. If you know the right things to ask for in the history, that will actually tell you what's going on with the person.
Wow. All right, so, but it's not a short treatment. You're in for a while.
No, this is a long haul. Your body is extremely unbalanced, gotten into very deep trouble. Like it's a deep hole that's been dug. It can take months to even see results, and it's usually going to be a long-term treatment.
So what's thyroid have to do with this?
The most common definable cause, most of the time we don't know why the thyroid poops out, but many people we can actually do a blood test and find out they have an autoimmune inflammation of their thyroid. This thing called Hashimoto's thyroiditis. It's a regular antibody test we do with regular labs. And in that case, then I will initiate these autoimmune treatments for these people. I reversed a few people without ever having to put them on thyroid hormone, just treating the autoimmune process.
Wow, and that shows up in a blood test?
Yes, but usually you have to catch it early. If somebody's had it for 10, 15, 20 years, usually enough of the gland has been chewed up, we're not able to reverse it. But if I get somebody pretty early on, I've had a few cases where we've been able to do that.
All right, I have experienced friends who have had lupus and the Crohn's disease. Both are just incredibly
horrible,
debilitating.
Absolutely, people can die from these. Absolutely. I mean, you have a range of people who are mildly affected to people severely debilitated and crippled, and certainly or need extensive bowel surgery. Very, very, very sick. Now, and quite frankly, obviously, the sicker they are, the harder and the longer it takes to kind of reverse that. But we got to start somewhere.
Okay, and a lot of that has to do with what they're eating.
That is one huge part of it. But other things, we have to rehabilitate the gut by restoring a healthy environment with probiotics, with gut healing herbs, sometimes using enzymes, acids, some of these whole things to start restoring the gut, getting the allergenic foods out of the diet. Is the first big step.
All right. You mentioned that probiotics, just for a quick question on that. Is that part of what you're dealing with when you're dealing with, say, autoimmune diseases and inflammatory? Is probiotics part of this treatment?
Yes, because much of these issues start with inflammation in the gut that then ripples out through the body. So the first thing you have to do is restore a healthy environment in the gut so that it's not becoming leaky to these proteins in our foods that are setting off the autoimmune reaction.
Now, I've seen anywhere from 5 to 300 billion. What's the deal on that number?
The problem is there's not really good research because usually it's done on proprietary products and things like that. I've heard from 20 to 40 billion. When you're dealing with inflammatory bowel disease, 10 to 20 billion. I have some products that I recommend to people that I've had some good results with over the years, but it's not hard and fast.
Okay.
Yeah, I wish I could say it was, boom, here's what you need to do.
The only reason I bring that question up, because I was standing in the health food store the other day, and somebody was looking at the probiotics.
Yeah.
And it had up to, I think, 40 billion or 50 billion.
Right.
And the mentality was, well, if I get the highest dose, I'll get the quickest results.
More is better, not always, but but yeah, it's for the more severe disease. But sometimes, especially my experience with older patients, is they don't tolerate high doses really well. You can't get somebody who's been 60 years out of balance and try to get them in balance in a month. The body, like, no, I'm adjusting to this. You usually have to go slower with things.
All right. Back to the aches and pains, inflammatory joints and things like that, arthritis. Where do you start with the patient? I would imagine a lot of people listening and say, it's just age, I'm getting older, I'm getting sore.
I say maybe yes, maybe no, but usually if they're saying that to themselves, they're not seeing me.
Yeah.
So if
or they're not working out.
Unless it's the husband whose wife has made him come in.
Yeah.
But otherwise, no. But it's people, if they're having these kind of things, I'll look at first I want to look at what they're doing now. If they already have a good diet, but if they're the typical and high starch diets and these things, we'll work on shifting that. I'll use some natural anti-inflammatories. The prescription or the pharmaceutical anti-inflammatory drugs as a class were shown in 1999 to kill 16,500 people a year. That's Motrin, that's Aleve, that's all the prescription ones, 16,500 people a year, which in 1999 was as many people as were dying of AIDS. So now it's more people because less people are dying of AIDS.
Why in the world are we prescribing this?
Follow the money.
Okay, all right, follow the money.
Yeah.
All right, so these anti-inflammatory over-the-counter things, be careful.
Be very careful. Tylenol's okay, but when you get, and this whole Tylenol's bad for the liver. Well, if you take a lot of it, yes. But when you get into the Aleves and the ibuprofens and these things, the older people are, the more likely they're going to have gastrointestinal bleeding. I remember when Motrin first came out on the market, and a doctor gave it. So I admitted as an intern, a 95-year-old Italian gentleman. I still remember his name. With his thick Italian accent. That he was vomiting blood from the 600 milligram Motrin prescription. His doctor put him on for his knee pain.
Whoa.
So the older you get, more sensitive. I really want to steer away from those unless they're absolutely necessary. Some people say I can't sleep, I can't do anything without them. Use the least amount you need to. We use some natural anti-inflammatory things. I have a lot of patients get very good results with to try to minimize the drugs while we work on these longer term issues.
Osteoporosis a part of this?
No, osteoporosis does not cause pain until you get a fracture. Osteoporosis is hormonal and inflammatory.
Really?
Yes.
All right, so are we rushing to get knee replacements and hip replacements?
No, because a good orthopedist will tell you, don't do it now because it's only got a 10 to 15 year life, and then we're going to have to fuse your joint. But are we doing them? I don't know. That's an ethical question. If you do a knee replacement on an 85-year-old? Well, it depends how functional the 85-year-old. Or if it was like my mom until she was 81 and a half, was teaching 10 exercise classes a week, jogging 2 miles in the morning and swimming a quarter mile in the pool in the afternoon. It all depends on, how not chronologically, but how physiologically. But no, usually the good orthopedists, we really don't do these things until they're absolutely necessary, because no surgery is without its potential complications, especially like a hip replacement, where people can get blood clots and these kind of things. So no, good doctors are making good decisions with that.
All right, let's wrap this up. When somebody comes see you, when are they, if they're beginning to suspect that they may have an inflammatory problem, autoimmune disease problem, when should they come see you?
Well, again, some of it, if they've already been diagnosed with something, then and they're just taking pharmaceuticals, those people are what I want to see. When the joint pains are getting to the point where some Tylenol won't help, and we're looking for other answers, those things, certainly if there are more multiple inflammatory issues, a thing that would bring anybody to the doctor says in the past 6 months to a year, it's my elbow, it's my hip, my low back, these types of things. But like I said, typically it can show up as anything, because all these different kind of problems can go into connective tissue issues. But those are usually the time when you start to look for it. If somebody's not severely affected, I'm not going to put them on a severe program.
Yeah. All right, well, there you go. You can get a hold of Dr. Klein at Ventana Wellness, or you can go to ventanawellness.com. That's the website. It's an incredible resource. And if you're suffering in one of these areas, well, you may want to consider an alternative therapy and treatment, at least a balanced one, when we put it that way, because you use a little of both, but you lean more towards...
we try to make the drugs as obsolete as we can, but we use them when we have to.
There you go. Good way to put it. All right, thank you, Dr. Klein.
Okay, thank you as always.
We'll take a quick break. We'll be right back.
Right.
Hi, I'm Paula, and I work at theDove TV. Every day we get letters and emails from people who've been encouraged, blessed, and challenged by the programs on theDove TV. But we couldn't do it without you. Did you know that more than 90% of our income comes from people like you? You can help us continue to bring inspiration and hope to our community by making a secure online donation at our website, thedove.us, or call us at
All right, welcome back, and delighted to have us, a couple of guests in the studio with us today. Mary Neal's with us and Paul Jackson. They are both facilitators with HeartChange Workshop, an incredible outreach and ministry that's impacting a lot of people. And Mary, good to see you again.
Thank you, Perry.
And Neel, good to see you. Or Paul, excuse me. And this is an interesting ministry. Well, I'll let you explain it, Paul. How did you get started in this, and what is it?
Well, it's the ministry is actually House of Myrrh Ministries, and HeartChange is one of the workshops that happens through the ministry. And how I got involved, well, a buddy of mine saw me return to church and saw the distress I was in, and he just approached me and he invited me to this this workshop. Of course, I had questions about it, but he really didn't have much to say about it. He just wanted me to experience it, and I was at a place in my life where I was ready.
Ready.
So that's kind of how I ended up going to this workshop.
How about you, Mary? How did you get involved in this?
My son actually recommended me to it, and I was very skeptical, to tell you the truth, about what I heard that it could do for a person's walk with the Lord. But when I experienced it, I was amazed at the depth of relationship that I can have with God, and I know I have with God, and that it frees me to have a better relationship with the people that I love.
That's wonderful. By the way, the website is called or entitled heartchange.org. Heartchange.org. What's the essence of the program, Mary? What's the bottom line?
The bottom line is coming to see yourself as God really sees you. And that's very hard for us to do, because all of our life we have layers upon layers of situations, perhaps traumas, and lies that we have been told about ourselves. And so when we have all of those layers, who are you, God, and how do you see me? And Paul has, I'd like Paul to add to that.
Yeah. What is it to you?
Well, I grew up pretty troubled, and there was definitely, like Mary was saying, layers, you know, like an onion of whatnot. I had glasses that I was wearing, perhaps you could say, that I was really viewing life through, and it was really warping the truth about God, about myself. I wasn't able to really assimilate the things that God was truly saying about me. I was rather kind of stuck in the walls that I had put up and the messages that I had kind of written on my own heart, and I got set free from that.
So what keeps you motivated? What keeps you going in this program?
Well, really, two things keep me motivated. One is I keep growing. You know, I've never arrived. I don't think I ever will arrive until that day. And the other thing is to see the miracles happen over and over and over and over again with the participants as they come in and they're broken down and quiet, and you know, the gamut of just how life has destroyed them, really, literally, or Satan, really. Yeah. He's the one that likes to do that. And they come in, and the light comes back on. Their eyes light up, and they begin to dance and sing, and it's good to see life come back.
All right, so how does somebody get involved? How do they do that, Mary?
They can go to the website, and it's an online registration. It's free, and that they click the schedule and scroll down to the one that they want to register for and click the word register, and it's a done deal.
How long is the course?
It goes Thursday morning at 9 a.m. and it ends at about, I'd say, 7 o'clock on Sunday. And each day is very long. 9 o'clock would be a goal that we have to end at each day. Wow. And it's obviously we break for meals. Sure. Yeah.
All right, so it's a Thursday, Friday, Saturday, Sunday thing. That's pretty intense.
It's very intense, and Paul and I were just talking before. It's about 50 hours that someone would commit to say, yes, I want more of God. Wow. 50 hours. It's well worth it.
So what are they going through during this time?
Good question. I got one question for you first.
Sure.
Have you ever spent 50 hours with the Lord at one time?
That's a great question. The answer is yes, but it was a long time ago. Yeah.
So, what was your question again?
Well, what are they doing in these 50 hours?
You know, in a nutshell, I could tell you about all the processes, but that'd ruin the secret for you. You know, you want to be surprised. But I can tell you this.
Well, I remember like marriage encounters, you go in with one thing and you come out and it's just another thing. And I'm assuming that's kind of what's happening here.
Absolutely. The transformation happens because each person that goes through the workshop spends the entirety of that 4 days experiencing for themselves, taking a look inside, taking a look into other people's lives, listening to the stories of each other's lives, and you know, so through a process really of different experiences, they get a little more than just knowledge. You know, a lot of people are you know, I grew up going to church and listening to wonderful, wonderful messages. And then I remember thinking to myself, okay, how do I do that? What does that look like? And by and large part, that was missing in my life. And this workshop provides the opportunity for the doing part.
All right, again, let me encourage you to check it out. It's HeartChange.org, HeartChange.org, and there you can register but also see the various schedules. I'm hearing a theme from both of you, and in fact, it reminds me of something that Patrick Doyle says a lot. He's the counselor we have on the air. He said there's basically two things that make you change: inspiration or desperation.
Yes, yes.
You know, you're either inspired to make a change or you're desperate to make a change. And what I'm kind of hearing here is you folks that go, all right, wait a minute, I believe, but it's not working. What do I do? Is that kind of the essence of what's happening?
Absolutely.
Yeah.
Yeah.
And so, and I, for you, Mary, you're still in it, so obviously it meant something to you.
It did. It did. It changed me. And rather than talk about me, I would like to share, if I could.
Sure.
And one thing I'll say about it is the age of the participants.
Yeah.
They can be as young as 14, and the upper age is limitless.
Okay.
We've had some very elderly people attend, and it's been beneficial.
Wow.
So I want to read something from a teen who attended recently. And she said, when I arrived at HeartChange, I was depressed and angry and afraid of the world. I had successfully taught myself how to lock the world out, perfectly masking my emotions. I attended church and I pretended to believe in God for years. During HeartChange, I experienced my emotions for the first time. I was terrified to come to know God and to start discovering myself, someone who the world had never seen. The whole time, I was surprising myself with how much I enjoyed myself. Leaving HeartChange, I felt like my world was turned upside down in the best of ways. I was headed down a road of self-destruction, and I know this young woman, so this is so exciting for me, of self-destruction, pain, and sorrow. And the love and safety of the Lord and my new family that I experienced showed me at my HeartChange so much that it has transformed me into a girl who is passionate about God and the amazing life that He has provided for me.
Wow.
Can you?
Wow.
The joy of that.
That's the
That's
essence.
why Paul and I do these, Perry.
Okay.
And I have a whole pile that I could read to you, but that's probably not proper on TV.
Well, nothing says it like a testimony. Again, heartchange.org if you're interested in signing up for it. Now, I understand you got one coming up in March in association or conjunction with Pacific Bible?
That's correct.
What are you doing there?
Well, if you'll notice, most of our workshops are Thursday through Sunday. This particular workshop in March is Wednesday through Saturday because we love pastors to come. Leadership in church, and that way they can still have their Sundays to do what they need to do.
Wait a minute, pastors come to this?
That's right.
Yes. Yes.
That says so much, doesn't it?
It does,
Yeah.
because I have a real heart for pastors and how sometimes they get a bad rap.
Yeah.
You know, because there's a lot of woundedness in the body of Christ. Are you needing to break?
Oh, no. Well, here in just, but you know, the part of that discussion is this. I have never seen so many pastors burn out as I've seen burn out in the last 10 years.
Really?
Yeah. And the sad part about that is that they're burning out alone. Nobody sees it, nobody senses it, and all of a sudden they're done. And you don't want to ever see a pastor end in failure or end in exhaustion or end burned out. But it's hard to believe that pastors go through what you went through. They're going through it too. And here they are, they're the disseminators of the word, and yet it's not working.
Yeah, and even if a pastor has no real need, it's still a great resource for them to be able to use. And really, that's one of the reasons why we're here, is because you know, the vision that the Lord gave me was that this could become a partnership.
Okay.
You know, pastors are burning out. They do have a bad rap.
Right.
And this could be a wonderful partnership.
All right, well, there's the other one. Check out the one coming up in March with, in association with Pacific Bible College and Pastors. That's perfect for you, Wednesday through Saturday. The normal ones are Thursday through Sunday. So, well, thank you both. This is great. I hope that people would look into this, take advantage of it. It's these kind of settings and these kind of workshops that are really changing lives in a big, big way, you know. I think we all have this spiritual mask we put on, and we get tired of wearing it because we have to put it on a good day and a bad day.
That's right.
You know,
That's right.
You get tired of wearing that, so you want it to come off. All right, check it out, HeartChange.org, HeartChange.org, and get registered there, or you can check out the one coming up in March at Pacific Bible College. So, well, Mary and Paul, thanks. Thanks for what you do, and bring some more testimonies next time.
Okay.
Okay.
Thank you, Perry.
All right, thank you. All right, we'll be right back.
Hi, I'm Daniel and I work at theDove TV. You know, compared to Portland, Seattle, and LA, Medford might be considered a small market, but at theDove, we're excited about the opportunity to make a big impact right here in our community. And you help make that happen. Did you know that more than 90% of our income comes from people like you? You can help us now by making a secure online donation at our website, thedove.us, or by phoning 541-776-5368.
Welcome back. Hey, what a delight and an honor to have with us today Robert Dickie. He is the president of Crown Financial Ministries, and I'm sure you're very familiar with that ministry. It's all over the place, does an excellent work across the country. And Robert is also an author, a speaker, a consultant, a columnist. He authored a book called Leap, The Leap, and that is Launching Your Full-Time Career in a Part-Time Economy. What a timely topic when the whole world's being cut back in their hours because of health care. Is that primarily it, Robert?
Well, absolutely. I mean, that definitely plays into it. There's a shift in our global economy. Regulation and the healthcare policies that we have now here in the United States are playing part into that regulation. But it also, what things that are impacting us also include technology and globalization. And all three of those events are kind of coming at us in a perfect storm and really changing our entire workforce and landscape here within North America and globally.
Yeah, you're hearing more and more about it, and a lot of college graduates are coming out somewhat discouraged because the full-time job just isn't there.
They really are, and they're getting hit with the double-edged sword here. They're graduating. Many of them have had to borrow enormous amounts of money to get through a very expensive college education experience, on average $30,000 in debt. And then they enter into an economy where the full-time jobs are not around like they used to be in the 80s and the 90s. They're having to put together 2 and 3 different part-time jobs. We're calling it the freelance economy, or gigonomics, where they're putting multiple gigs together to try to just make ends meet. So they're really struggling.
So what do you mean by the leap? What do you mean by the leap? Oh, did we lose?
Well, the leap, first and foremost, Perry, the leap, I think that people need to take a mental leap, right? To understand that this is no longer our grandparents' economy. In the past, we could go from graduating from college, going directly into the workforce, staying there for maybe 30 years and retiring. That's just not available for most people today. So we need to make a mental shift and realize that we're going to have, at least young people in particular, going to have anywhere from 8 to 12 little careers within their lifetime. So they need to be intentional and planning to be able to navigate that. And even people who are later in their career are finding that they're going to have to start multiple careers late in life as well to kind of make ends meet into retirement. So we've got to change our mindset.
Now, part of that comes into planning, and I know you highly recommend that. Give us a little bit of an idea.
Well, I think first and foremost, one of the things that I recommend in the book is for people to truly understand how God created them, how they wired them. Many times people have this vision for themselves and like, well, I really want to do this, or, my mom and dad really want me to be a doctor or a lawyer. They spend an enormous amount of time and money going down that path only to be unfulfilled. And those are mistakes that we can't make in today's economy. But if you start with a plan, and I recommend taking a career direct assessment, understand how God gifted you, how he wired you, your skills and so forth, you'll know that you are in alignment with what he wants for you in your life. We have found this tool to be enormously successful to help people pick the right career and to then be able to have success in that career.
What has this digital world done to jobs and going to the office? We're hearing about more and more people living where they want to live, working from their house. Is that working?
It really is. You find a lot of people who do this. They're freelancers, big multinational Fortune 500 companies are hiring people to be able to work out of their homes. You have call centers instead of being outsourced to India. You can actually do that from your home today. So there are certain career fields that lend itself to people be able to work out of their home, keep their costs a little bit lower, and have a little more freedom. And so those are some of the benefits. A lot of times people hear about this free agent economy and this freelance work. They think of the negatives. One of the things I try to highlight in my book is that there's all sorts of positives to be able to function in this new economy.
Are we in some way, Robert, are we forcing single taskers to become multitaskers?
Well, I would say that that's a very good question. There's a lot of people who are being forced to multitask in a number of different areas of their life. Me personally, I've just grown accustomed to it. But it's a skill set that I think that people need to hone. But, unfortunately, the folks who aren't really good at multitasking kind of find this new environment to be a little bit overwhelming. But with the proper planning, with the being intentional with how you set up your daily life and your daily routine, I think it's quite manageable.
Now, a lot of people approach this, what you're talking about, it is somewhat frightful. There's a fear factor involved. How do I do this? I was trained to do one thing, but I'm going to have to do leapfrog to get to where I want to go. How do you encourage them there?
Well, I really encourage them that, it really depends on your mindset. If you look at the challenge or the obstacle in front of you as negative, and you really start to, water that seed of doubt, that's all you're going to see. But if you back up and you create a plan and you understand that everything that God puts in our lives is there for a reason and that we can overcome this so we can get stronger, you really start to look at the world with a positive mindset. It's amazing the opportunities that come along. It's amazing how you can pay it forward and help other people have more freedom in your life instead of being saddled with debt and all these expectations that society want to place on us. That if you start from the beginning with the proper mindset and the proper plan, this is actually a very exciting journey.
All right. Now, how do you help the Christian who's struggling with this to look at this from more of a significance than a success? When the world is trying to force us to be some successful, according to the world's definition, God wants you to be content. That seems to be a pretty tough one to balance.
Yeah, and one of the things, this is a theme that I have shared over and over again with the places that I've been speaking around the country. I believe that God wants us to be content, but not to be complacent. And there's a really big difference between the two. So, the world, I was just speaking with a university in North Carolina, And they were trying to unwrap this whole why is it that we feel like the need to be so materialistic and to be a consumerism type of society? And that is because of this advertising bombardment that we're on, 24/7. And when you can pull yourself back and you realize that our success, our significance, our self-worth has nothing to do with our job, has nothing to do with the car that we drive or the home that we live in, but it has everything to do with our relationship with Christ. And we start with that mindset first, and then we try to figure out how we can help others. It's a completely different paradigm shift. And so, I'm really passionate about helping people in my book understand how they can get there.
You say in your book, faith not tested is faith not to be trusted. Boy, explain that one.
Yeah, I've experienced that in my life, not only as a Christian, but also as someone in the military. So let me highlight a military example. When you're going through boot camp, all the time, you're some of the strongest, most, competent individuals that you'd say, man, this individual can handle anything. But you know what? You never really know until you get on the battlefield and the bullets start flying and the stress is high. It's amazing. Sometimes the people who you thought were going to be the strongest person in the platoon or in the squadron have just a complete mental meltdown. They couldn't handle it. And so, I have a number of friends, Navy SEALs, they say, we don't trust anybody who has not been combat tested. We want to know how you're going to react in that situation. Life is very similar. We can go to church on Sunday morning. We can say all the right things. We'll live in a perfect life with no stress. But when the storms of life come, if you've never been tested, you don't know how you're going to react in that situation. So when a storm comes and you're being tested, don't take that as a sign of, woe is me. Realize that that's an opportunity for your faith to grow, for your strength to grow, for your relationship with Christ to grow. And by that, you're going to be able to help other people in your life.
Powerful. All right. The book is entitled The Leap, Launching Your Full-Time Career in a Part-Time Economy by Robert Dickie. There's a picture of it there on the screen. I would assume it's available at the bookstores, Amazon, Barnes & Noble and such.
Yes, sir, they are. And I've got a number of free downloads on my website at robertdickey.com. So I've got a number of free things there for people who are reading the book to kind of help them get started in their journey. So feel free to use those resources.
All right, leave us with a little nugget. Of all the things you mentioned in the book, what's the ones you're passionate about?
I would say my biggest passion is to help people understand their God-given uniqueness and their ability. Start with the end in mind. Don't try to take a leap without having a plan. And I'm not talking about a plan with your finances and debt. Truly understand how God made you and gifted you. And when you live your life in alignment with Him, you are going to be in for an amazing, wonderful journey where you're going to have massive impact in this world.
Do you have in the book a suggestion on how to qualify that? How do you qualify yourself and what you are gifted to do?
Absolutely. I speak very in-depthly about this. I recommend that everybody go and take a Career Direct assessment. You can go to careerdirect.org, O-R-G. This is an assessment that Larry Burkett made a number of years ago. We've used it globally all around the world. Over 100,000 people have gone through it. And we hear testimonies time and time again of people who had been misaligned. They didn't understand how God made them. And when they took this assessment, it just opened up their eyes. They're like, wow, I'm no longer struggling. I was hitting my head against a brick wall. I had obstacles. I don't have that any longer because I'm living in complete alignment with how God made me.
Wow. Well, this is a tremendous resource. The book is entitled The Leap, Launching Your Full-Time Career in a Part-Time Economy. And it's a big red book. You can't miss it. Pick it up at Barnes & Noble or on Amazon or at the bookstores. Or you can get excerpts from it and downloads from it at robertdickey.com, robertdickey.com, and take a look at it. I think you'll find this to be a tremendous resource. Well, Robert, I want to say thank you to you and all the people there at Crown. You guys provide a wonderful service to people, and I know churches all over the place that do your programs, and I just want to say thanks for your steadfastness in what God called you guys to do.
Thank you so much, sir. We've got a wonderful CEO in Chuck Bentley and a great team, and so it's our honor to be able to serve.
All right. God bless you, my friend. Keep up the good work.
Thank you, Perry. Have a great afternoon.
Later. All right, there it is. And again, let me just encourage you to check it out. It's called The Leap, Launching Your Full-Time Career in a Part-Time Economy. And you can also get excerpts and downloads there at Robert's website. And that's Robert Dickie, and that's IE, robertdickey.com. Check that out, okay? We'll see you next time on Focus Today.
Hi, I'm Jim, and I work at theDove TV. Every weekday between 6 and 8 a.m., our award-winning news and sports team bring you the best morning show around. It's live, it's honest, and it's a whole lot of fun. And you help make it happen. Did you know that more than 90% of our income comes from people like you? You can help us continue to air local programs that share your voice by making a secure online donation at our website, thedove.us.